Good afternoon, everybody, and welcome to Zahn Academy. Today, we have a presentation from Dr. Andrea Colón from Nemotec, and we're going to be speaking about Nemotec software for implant, guided surgery, and orthodontic planning. Dr. Colón is a dentist from Spain, and she now is the clinical department director for Nemotec. Dr. Colón has prepared some poll questions for us, so please, we'd love it if you'd be interactive with us to answer those poll questions. And I'm going to turn this over to Dr. Colón, and I will be launching that first poll question right now. But just know that we will be taking a Q&A at the end of her presentation. So at any time during, you can type in at the bottom of your screen any question that you have for her. Thanks, Dr. Colón.
Thank you, Fran. Hello, all. Thank you for being here and assisting to this, attending to this webinar. So just to give, already Fran gave a little bit of my introduction. I'm Andrea Colón. I'm a dentist and I'm part of the Nemotec team. I have been working in Nemotec almost 6 years. So very involved in all the digital workflows, design, development of the software, and also we have a planning center where we received and have plenty of our clients that also request our planning services. So for sure, I'm very capable in this on what is called digital dentistry, and I have a little bit of experience in between the lab products and design, and then the dentist part, a specialist in prosthodontics. So today, I hope that this information that you are going to have will be very interesting for you and that you get to know our software.
Dr. Colón, I have the results of the first poll, and I'm sorry for the typo, everybody, but it is, do you use a CAD in your laboratory? 57% say they do, and 43% do not. So I just wanted to let you know what the results were. Thank you, and thank you so much for answering.
Okay, great. So let's go ahead. Let's start. So today, I'm going to share with you what is the Nemo Studio platform from Nemotec and why this is going to be very interesting for you. Well, I'm going to tell you a little bit what is Nemo Studio platform about and how the software for implantology and orthodontic planning will be interesting for the services that you provide and how you can benefit having this software in your dental lab. So please, if you have questions during the presentation, don't hesitate to do it. So just to give a brief of the history, Nemotec, it's doing and development software from 1992. So during all these years, we have been developing different modules that has led us to what it's called the whole platform. So in this platform, we have around 8 modules. And then we have number 9 that is coming soon. But basically, all these modules are going to be an integrated, interdisciplinary, and comprehensive platform for doing examination, analysis, diagnosis, design, production, everything. So you can have all these functionalities in one platform. So the main idea when I talk about interdisciplinary is going to be that we try to cover every discipline of the dentistry, and then join them and try to do a comprehensive planning to offer to our clients. So you have the possibility to input records, do analysis and planning, full diagnosis, communication and approval, design, then go to manufacture and also get the entire history or records of the patient during the time, and try to do planning in the different stages of the treatment, because you can keep all the record of the patient in one platform. So then I'm going to show you how it is about. But all these functionalities are going to come in two different presentations or formats. There's going to be the Windows application and then the web. So in the Windows application, that's going to be here, you are going to have all the power of the platform. I mean, here you can do everything from diagnosis, preparation, planning, and manufacture. Then the web application, even that you can see the same case, is going to be more doctor-oriented or client-oriented, because it's going to allow you to do visualization. Is an approval tool that you're going to use. It's going to allow short modifications. So basically, you are going to have a full platform where you get to get the most important from both. That is going to be the Nemo Studio Cloud full platform with the treatment planning, product designs, all the functionalities, Boolean operations. It's very comprehensive. And then the web format that it's going to come with a editor, the possibility to plan light treatments like simple planning, and also use them as a viewer. Okay, so you can have both platforms to communicate. So we're going to talk a little bit more about that, but let's going to talk more a little bit of NemoScan. So we're going to focus in implantology and orthodontic. So let's start with this, that it's going to be your implant planning and guided surgery software. And NemoScan will allow you to do a full planning of implantology, taking into account your WhatsApp or your prosthesis design. So this is very positive for you, because you can work with obtaining a huge predictability of your planning. Then you can have also the possibility to have 2D records to match the photo with the 3D STL. So you can have a small facially oriented planning and go forward to this comprehensive planning. Then you can have virtual instructions and all kind of layouts to obtain a really accurate planning, alerts, safety regions, and then at the end of your planning, you will have an automatic surgery report. So this automatic surgical report, you will share it with your client about the planning that you have made for them. And then you have the possibility to work from single to multiple implants, and also to work in a full edentulous cases and plan an immediate loading. As I said, you can use the picture of the patient, you can do a facially prosthesis mock-up, and all the stages that you need to cover on the clinical process, you can handle it inside NemoScan for the implantology services. So which kind of products you can get from NemoScan? Well, you will have drill guides or pilot guides that are going to be on those cases where you just want to offer just a guide to just do one drilling and set the depth and the position of the future implants that you're going to place, or the full implant guides that will allow you to make for the user the entire drilling sequence and place the implant through the guide. So this is another type of guides. And also we offer the stackable guides. So these guides offer you the possibility to do bone reduction, to place the anchor pins, to do the immediate loading, the placing of the implant, just with one guide that's going to come by different stack pieces. And this is very useful nowadays to save time during the surgery and do several processes or clinical process in one time. Also, you have sign-up lift guides, temporary restoration for unitary crown or ridges with a custom emergence profile. Then you can have healing custom abutments. So it's a huge possibility of different kind of product that you can offer in the same platform. So then I'm going to show you a little bit of a case that I have here, so you can see a little bit how we can manage in the platform. We are going to have the preparation of the cases with artificial intelligence. Okay, so all these features will be available for you. We'll give you cases. For example, this is going to be the original bone, and then you can have result like this one with that feature. So all the preparation part, you can skip it. I'm going to show you then how it would look like, also how to segment maxilla and mandible. All the stuff will be automatic. And then you only need to go and saving this time, you only need to go to the planning part where you get to place your implant. So in this part, for example, you will be able to create pass from a full teeth model, from a full edentulous model with virtual extractions. Okay, that are going to be here as different meshes. You can do your WhatsApp. You can also import a WhatsApp from another software if you want to. So this is open to export any mesh or import any kind of records. Then you can have different treatment plans. Sorry, I need to move this toolbar just a second so I can. Okay. Different layouts to work and plan in a safety way. Okay, so this will be, for example, an implant. You can show the safety margin. You can work tilting the implants, inclinations, rotations. So here you will have all the information. You can change from implant to implant, different kind of libraries to choose. Then also you have the possibility to choose abutments from the libraries also. The different surgical kits that you can use for your treatment plans. And then all this information will be set just for you to select and define which kind of surgical guide you want to use or surgical kit according to the brand or the system that your client use. Also libraries of anchor pins, and will be the same, will be managed the same as the implant, same tools to move them, to tilt them. You will have the possibility to have different kind of treatment plan. For example, in a very complex case, you want to give the client to different approaches for your treatment plan. So this will be possible to do it from here. So you can send, hey, I have done 2 treatment plans, so let me know which one fits the best for you. Which one do you think is going to be the best one? And then also, when you finish your planning, you will get to design your surgical guide. So you have different options here. Maybe you want to work. Oh, sorry. Just give me this room. Oh, I will need to open again. So in the meanwhile, okay. So in the meanwhile, this is going to open. Give me a second. Let me connect this. Sorry. Okay. Okay, maybe because I'm sharing and I have too many cases open. Okay, so all these, I was saying that all that kind of designs can be exported and manufactured in any kind of device. So that is not restricted to do it. Let me open this. Okay. So it's open to export those meshes and production. So I'm going to move to the next software while I'm opening the case. Okay, so then we have NemoCast and NemoCeph. So in this, these two softwares or modules are going to be like a complete comprehensive solution for orthodontics, because you can combine what are going to be your cephalometric traces is going to be a 2D software, while the NemoCast is going to be a 3D software. So this is very powerful because you can take both components of these softwares and combine for a better diagnosis and services. So let's say you are going to start with a cephalometric tracing where you have more than 50 analyses included that you can work with. The user is going to ask you always which kind of analysis they want to use, which one they're using in the clinic. Then from this cephalometric prediction tracing, you can do a growth prediction that could be maybe to 1 to 2 years, and then see this prediction in a morphing with your photograph. So this will show you how the patient can look like with that prediction doing this morphing of the picture. So that it's very interesting. Same for tracing superimposition or the lateral photography with this X-ray or the morphing. And at the end, you also can get this report to send it to the client. It will be also automatic, and you have the possibility to work with an automatic placement points. So this is something that we are offering in the web application. That is going to be this automatic tracing. You only have to add like 3 points, and then the rest is going to be done automatic. And then you have NemoCast. So NemoCast is going to be this 3D software. It's going to work together in a perfect way with NemoCeph. So in this part, you will get to have a model analysis where you have plenty of options to know about discrepancy, measure distal and buccal lingual angulation. You have Bolton information, Andrews keys, ABO. So all that part for a full diagnosis. Also in this software, you will get the possibility to integrate your CBCT. So this is a very nice tool because those cases that could be also very complex, the user or the client could say, okay, I prefer to do it with a CBCT because I get to know where would be the position of the root. So it's like a deeper diagnosis and planning tool to do it. Then you will get the possibility to do your setup for aligners. So it could be a manual, or you can use the help of the automatic proposition of the software. And for the staging, you will get a whole control to adapt the movements per stage, to divide or individualize each movement in the different stages that sometimes in another software they have to be together. So here you can individualize each of these kind of movements, rotation, tilting, inclinations. And also you have the possibility to have the articulator. So in the articulator, you could evaluate which ones are going to be your contact. So you can do a full occlusal diagnosis on how this is going to look like, which kind of contact are you looking for, which is going to be this kind and guide or overjet, overbite. So also you can use it during your treatment plan. And the last thing that we are developing is going to be like a hyper realistic result with AI simulation. It's going to take the information of the setup that you have done and do a mapping on the picture of the patient to show how the patient can look like from this treatment plan. So this is very important and amazing for your clients because they can use this for a better acceptance of the case. So you can offer this service also that will help them to engage the client and sell more treatment plans. So which products you can have from the NemoCast software? Well, I was saying you can have aligners, okay? It's going to be here. You can have aligners, you can get indirect bonding or direct bonding guides. So this means that you can get also to have what is going to be a bracket setup. So not only aligners, you can work also and offer this service maybe for those doctors that still doing this traditional orthodontics that of course is demanded in some cases depending on the complexity. So also you can offer these kind of devices. Also you can plan micro screws. You can plan MAR-based planning for maxilla expansion. So it's very comprehensive in the portfolio of product that these softwares also can offer you. Okay, so I'm going to open, let me see if I have it here. Okay, so I open this other case. I'm going to, at the end, if I get more time, I will take back the other one to show you the stackable. I would like to do that. I think we have enough of time. Okay, so this is another implant planning where you can have the picture of your patient mapped also. So this means I was telling you that you can combine the possibility to do your prosthesis design using the face and the fascially guided design, and then go to add your implants. So this is very nice in the cases where you are doing an anterior sector or maybe for a full arch. So you don't need to have maybe another software to do it. You can do it from here. Then also, sorry, move to the other screen. Also, you can have in your articulator, say, different kind of occlusal relations. So this means that you can have the relation of the occlusion of the patient. So you can manage these options to do your WhatsApp, and then you have the possibility to align this model to the CBCT. So let's say you're going to do upper planning, and then you're going to do a lower proposal. So you can do it in a separate way and show these two options to the patient, to the client. Okay, so here you can see how these bones are going to be created by the automatic preparation. So they're going to be very, very nice bones to work. For example, if you need to design a bone reduction guide that is going to be bone supported, these kind of meshes will be very, very good to use them to design. Also, you can get the dental nerve, you can have sinus, and also you will get the alignment of the models with the CBCT automatic. So this means that you can save all the time and start doing your planning directly. Then you get to design your surgical guide. For example, it's going to see the upper one with the upper treatment. Going to hide the prosthesis. So this is going to be a traditional surgical guide, okay? And as you see, this is going to be some angulated abutment. So on those cases where you're going to use tilted abutment or tilted implant, you can modify the emergence using this kind of abutments that you will have on your stock library. So you already know how to place the implant and how to which one is going to be the final position according to the indexation of the implant. Okay. So this will be like a classical design of the surgical guide. Okay. So I will be opening another case. This maybe take me a little bit because of the connection. So we can see a little bit of the stackable guides. And as you see, this is going to be like the landing page for the Nemo Studio. This is the window application. So the look is going to be similar to the web. So they are going to share. The only thing that is going to change is that when you entered directly to the case, of course, it's going to be the different functionalities. Also, as you see here, you can create different kind of document of the patient. So this will get you to have the entire history of the patient. So it's a platform that is going to be patient-centric, sorry, and this will allow you to have like the full history of the planning. So if maybe a client is treating a patient and plan to do another kind of, I don't know, place one implant right now, and in 3 months they need to place the other one because they had to do a regeneration bone process. So you can go back to the same the same patients to see which kind of treatment plan we did long time ago, and or maybe superimpose any STL or scan body STL with the original planning. You can see discrepancies. You can do CBCT alignment of the postoperatory CBCT with the previous one, and you can evaluate how these how your plannings are going, are being accurate for you. So maybe that will be interesting also for you. Then I was showing you how this kind of stackable guides will look like. So you will have the design of a base and then the possibility to place an implant, and then you can obtain your immediate loading capturing. So you can have this kind of guides with or without bone reduction. Also, you have another type that will carry out another kind of immediate loading. So for example, this will be the base, another type of connectors. Okay, so you have another type of connectors. You will have your surgical guide. So the connectors you can choose between the ones that we have available. And then the immediate loading that could be used with this kind of basket to take it to the mouth. So you have different options to work with. But basically, all our products are going to be based in predefined workflows. This means that you can have like step 1, step 2, step 3, and do this kind of whatever the software is asking you to do to have the final product. So it's going to be very user-friendly to do. And of course, this kind of design that sometimes are very tricky to do will be easier with this kind of workflows. So in the upper left corner, you will have this implant icon which displays all the licenses of the different modules that we have. I was telling you that we have a software for implantology. We have the Smile Design only for mockups, motivational designs. We have the NemoCast I'm going to show you right now, and the NemoFab for orthodontic. So all of them are going to be together. So this is what I call that it's going to be integrated and comprehensive for you. So this means that, for example, if I want to go directly to a Smile Design, for example, I can go directly from here, from my implant planning, and go directly to the prosthesis work mode of the Nemo Smile to do another kind of procedure. Or maybe I want to combine an ortho with an implant planning. So this is going to be very unique of this platform. And then you don't have to do different orders, charge again the SCL, start again, because you already have all the record of your patient here. So this is very, very, for me, it's the most important advantage that you can have. Then different tools to do your WhatsApp, to move teeth, to change, different kind of libraries, about 40 kind of teeth libraries you can combine, do virtual extraction, as I said. So this is very, very complete in this part. So in any time you can open your articulator and check how is your design, how it's doing, and you can do it in every module. You don't need to be in just one module or whatever. So you have different tools to deform, not only to move, to deform edges, to adapt the cervical part, to do a very aesthetic design. So also you can get this from NemoScan, okay? Then let's go to see a little bit of ortho. So I'm going to open a ortho case so you can see a little bit of the setup and the timeline that we are going to be able to do. So remember, if you have any questions, you can do it. Okay, so I can answer them. So also in this document, apart from the planning that you have done, you will have the different kind of register of the patient. If you want to have pictures or any 2D document, a PDF, or a prescription from your client, everything can be there. Then this is going to be an ortho case. As you see, I can see the same modules if I display this from the icon that I already showed you before. Okay, so this is going to be a setup that comes with a CBCT. So this is a possibility. You don't need to do it always with a CBCT, but it's a possibility to do it. Also, you can integrate the picture of the patient. Okay, so you can do it from here. You can create masks, whatever that you need to check your proposition to the patient, okay, to the final patient. And then in the left panel, you will have the different functionalities and information about your treatment plan. You will have on the upper left, the information about how many stages you have for your setup. You have the different tool to move every tooth, or you can do it from here. The gingiva is going to be the morphing according to your movement, okay? Then you have the possibility to add any attachment to the treatment plan. So these attachments are completely customized, modified. You can also create your own library attachment. So how? As they are going to be customized, and you can edit this attachment, scale them, change, okay? So it's going to give you also the proportions on the numbering. Then you can save and then create a new, let's say, a library attachment that is going to be personalized by you, customized by you. Also, you have different appliances, elastic hook, button cut, also brackets for the bracket treatment plan. So all these will give you different tools to use during the entire treatment plan to move the teeth. And then also you can make extractions from here directly. So this, every time I'm going to show you later how to, this extraction is going to be reflected in the timeline. And for example, to be here, you can check your spacing labels. There's going to be shown as collisions or spaces between the teeth. Okay, so it's going to take this calculation from the treatment plan that you have done. So everything that's going to be in red are going to show you collisions, and everything that is going to be on blue, it's going to tell you, for example, that you have 0.1 of space between those teeth, okay? And all this information, you can manage them in the timeline. So how we are going to see the timeline? So in the timeline, you will have the entire sequences of each movement. So if you displace every tooth, you're going to check which movement are associated with this, with that tooth, and in which stage is going to be. Also, if you need to move them, to change them, to see, I don't know, maybe you want to avoid any collision, so you can do it from here, individualize each movement. So from here is going to tell you also how many degrees or millimeters is going to be the movement that you are doing, okay, for the entire movement. For example, this is going to be 0.15 millimeters. And then the attachments also it's going to be reflected here, and then during the stages it's going to be shown that maybe we go back here. It's going to show you where you have to delete them. So for example, in this treatment, all the attachments are going to be in the entire treatment. Okay, so all the information is going to be reflected. Then, of course, you have like the simulation of your treatment plan, how these tools are moving according to the stages of the treatment. So these kind of videos, also you will share it with your final client to check how this ortho planning is going to get to the final result that you have planned for them. Okay, so all of that is going to be reflected in this kind of let's say powerful visualization and videos to share. Okay, more of these, you can see the initial stage is going to be in a different color. Then you can watch them both to see the discrepancies. Okay, then the setup itself. Also, you can have like the bolt-on analysis with the discrepancies in the upper and lower arch. You can do, to be back. You can do, for example, an extraction. I'm going to show this, an extraction. And then you can add a prosthesis. That is going to be this pontic that you can use in the cases where, I don't know, you have a treatment plan where you have to keep a space to place an implant, for example. So this will be a possibility to do it. So this pontic is going to adapt automatically with the spaces while the teeth are moving, okay? Then you have the possibility to plan these micro screws. So again, you can work with the 2D information of your CVCT. Okay, so you can plan micro screws, you can design micro screws guides for placement. These micro screws also come from different libraries, the same for a marpiece design. So you can get, this model is a little bit short, it's cut here, but this is more or less how you can plan a marpiece design, and then you can print this together, the shape of the marpiece to get it directly and do the other manual processes in the lab with the marpiece treatment. So plenty of possibilities that you have in this software. Also, if you want to work or do your ortho over a mock-up or a prosthesis design, also you can do it, that it's possible. And for sure, you will have a final PDF, okay? This final PDF, you create it from here, you place the number of the doctor and clinic. You have this type of timeline PDF, okay? And then you have another kind that is going to tell you, for example, in which stage is going to be placed an attachment, then how it's going to be removed, and where you need to do IPR. So this is going to be directly for your customer. Okay, so this is very important information. So all this is going to be also get automatic from your treatment plan. Okay, so getting back, I'm going to give you just a few final like most important benefit that you can have from this software, because as you can see, it's like a huge and comprehensive software. It's an integrated interdisciplinary. So this means that you can combine Implant, Smile Design, or Ortho and Orthodontic, or Ortho and Implant. So in any time that maybe you don't offer, I don't know, any kind of device or services, in any time you can expand your portfolio to offer, because you have this huge platform to do it. And also it's going to be patient-centric, as I told you before, so you can have all the software with picture, STL, CVCT, all the modules and the treatment plan can use these tools to be planned, and also you can keep all the records of those patients or orders or cases in one document that will help you to, in a future, or maybe do a retrospective analysis of your treatment. Then it's going to be cloud-based, okay? So all the data is going to be stored in the cloud. So this means that all your workstation is going to share the same data. So this is very interesting, because all your team is going to get access of the data of the same center. So this means that you can work on the same, let's say, patient or treatment plan, and share with any colleague. Then you have access to the AI features with these cloud services. You can set users and roles within the team work, who is the planner, who is the administrator, to control on how the plannings are done, who is doing the planning. All your data is protected, okay? You will get access by web also to this kind of data, not only on your workstations. Also, you can customize how it's going to look. If you want to place your logos, fonts, colors, we can offer you that possibility. And according to the service, we use AWS, and we have worldwide location depending the country. So we have different location of this service. For the AI features, it's very important. Today, it's something that is must use. Everything has AI. So it's AI driving case preparation. You will get the automatic alignment of the model, automatic segmentation of the anatomical structures, airway, sinuses. So this is very comprehensive AI photo alignment, and also the autocephalometric tracing. It's open for any kind of 2D and 3D format. So this is very, very user-friendly, so you don't have to, also for OBE, PLY, STL, CVCT, and DICOMS files. Then it's a very powerful tool for communication and approval. Why? Because you're going to use the web platform, and you will share it with your customers. You can share the viewer for this approval. I'm going to share. You can share in an easy way this kind of document. So the user only have to click on the link, check it in the browser, and give you the approval of that treatment plan to follow with the production and the manufacturer. So this is how maybe a viewer can look like, how the client get to check the planning. Okay, and also it's going to be there the entire meshes of the treatment plan. You can customize which kind of meshes you want to share with your client, or maybe, for example, for the final client, you can say, okay, I'm going to give access to all my clients to Nemo Studio Web with an ID and a user, so they can upload the cases and send the orders directly to me, and also get to see all the cases they have done with us. They can do small modification of the treatment plan, so that it's also a possibility. So it's the Nemo Studio Web, and then the online viewers to enhance this communication with your client. Okay, I need to go back. Sorry that I have to do that. The toolbar doesn't allow me to do it the other way. Okay, so then design and manufacture. I already said that you can export any data of your design, import, and you can manufacture in any system. It's open for that. And then for sure, we have a huge team for training and support. So you have a technical support team available to help you with anything that you need. And then we have an online training platform. So here we do weekly live courses. We do always like clinical mentorship, video tutorials. You will have master classes. So all of this is going to be in Nemo University. Okay, and in this platform you will get full information to be trained, but also to learn new things. And we have a huge team of also clinical department, more doctors and technicians that are going to be able to support anything that you need beyond these other things that we offer. So, do you have any questions? If you made it until here, I'm very glad that you stay. If you have any question, this is the moment to do it.
So, Dr. Colón, I have two more poll questions that I could launch right now. And the first one is, do you feel confident in the CAD that you're using for your offerings? So if you wouldn't mind just answering. And I do have a question that one of our viewers came up with. They want to know, does the software have more design options or just implant bone reduction and ortho?
Okay, yes, of course, with the platform that we are offering, that we're going to offer to the labs, they are going to have access to all the modules. So in any time they can go further and use any of the other orthodontic platform, for example.
Awesome, thank you. And then we have one more that's speaking on surgical guides. Do you feel confident with your CAD to offer surgical guides for implant placement and ortho to your clients with the CAD that you already have? If you wouldn't mind answering. And so far on the other, we have some attendees that feel 100% confident in what they're using right now. And from what I could see on this one, we have a 50-50 split. Actually, no, they keep answering. So far, 67% do not feel confident in offering surgical guides with the current CAD that they're using, and 33% are confident. What do you have to say about that, Dr. Colón, if they're not confident?
That you need to try this platform.
Okay.
You have to give it a try. So this is we have well, to be open to try new things on in the market. So this is a very powerful tool for you. At the end, the idea is that you can get only 1 to 2 software max to do everything that you need, because you need to save time, you need quality, and you need to be faster in answer to your clients. So I think it's a good opportunity.
And we have one last question that I'm going to launch for you. Hold on just one second. Having a little technical difficulties here. So I just want to let everybody know, while I'm having a little bit of a problem, I have to end a poll, that's why, that we will be having training on Nemotec in May 30th and 31st at our Wakefield training facility, which is located in Wakefield, Massachusetts, about 20 minutes out of Boston. This particular software is, definitely user-friendly. It is cutting-edge technology with many more applications, as Dr. Colón had said before, that can really widen the scope of your lab's treatment planning and production capabilities. So if you have any type of feeling like you would want to possibly do this or want to discuss more, you can contact your Zahn representative, or one of us will get in touch with you from answering the poll. I'll also be sending you an email as well, specifics on the course, as well as a discount code to attend the course since you watched this particular webinar with us. Up next on Zahn Academy, we have next week, April 10th, navigating 3D printed resins and how to choose the right workflow for your lab with 2024 CDT of the Year, Dennis Urban. And the following Wednesday, April 24th, we're going to take a deep dive into an integrated solution from design to mills featuring Hyperdent and XT Cera mills with Milos Markovic, CDT. We are coming to you with our Zahn roadshows on 3D printing and other solutions. This month, we're going to be in Nashville on 4/19, and next month we'll be in Salt Lake City. So check Zahn Academy for other dates from now until the end of the year. We'll be at a different city every single month coming here. I just want to thank Dr. Colón so much for joining us from Spain, Madrid, Spain. We know it's way past your work schedule there today, so we really thank you so much for joining us. And we'd love to have you join us in Wakefield. Remember, it'll be our Zahn team as well as the Madrid, Spain team coming over to give you some training on Nemotec. So thank you so much again for joining us here at Zahn Academy.